afternoon, everyone. My name is Masae Kato. Thank you, Carrie, for introducing me. I'm a postdoc researcher at the Center for Bionetworking together with Margaret and other colleagues. My presentation is titled "My Grandfather Cut a Tree." Well, I think as I proceed with my presentation, you will gradually come to know what it means. But I would like to introduce you cases from Japan in genetics, family and individuals, especially in the framework of inequality, discrimination, how genetic information affects individuals' life and their surroundings. Well, this presentation is based on my field research on the practices of genetic counseling in Japan. And my field research was conducted between 2006 and 2008. Some data collected this year, 2014, in Japan is also added to it. I mean, I knew I would make this presentation, and I wanted to make sure how things changed and things may not have changed. My special focus is on the impact of genetic information, namely how it affects a person's life when he or she is diagnosed to have a genetic disorder. In the abstract, I am giving a special focus on the way genetic information is protected in hospitals and its consequences. In order to discuss that, let me first map out what impact it has when an individual is diagnosed to have a genetic disorder, and how it affects the surroundings and how all these are embedded in culture. Well, as you can imagine, genetics is a sensitive issue. If a disorder is in a family line, it is not only the individuals with the disorder, but also family members who are discriminated, being followed by difficulties in finding a job or finding a partner. This has to do with the meaning of genetics in culture. Although an increasing number of diseases is explained with the scientific knowledge of biology, the cause of genetic disorder is still attributed to a number of non-scientific explanations or sometimes superstitions. Now let me look at effects of the diagnosis to individuals one by one. I would like to introduce you here a narrative. Mr. D was diagnosed with spinal muscular atrophy in 2001, and he was about 60 years old, which is a late-onset muscular disorder in males only in men. I asked him what his first reaction was after the diagnosis. He explained, "It was shocking to know that my disorder was genetic, specifically genetic. This was the last thing I hoped for. It means that this sickness is myself and it cannot be cured at all. I cried 3 full days wrapping myself in a blanket. Having this information, I felt I was branded." Well, genetic information determines who we are, and when the disorder is genetic, I become the disorder itself. Well, this is interesting, but this is not quite new to us. I think all of us know more or less come across this kind of way of saying. To be focused here is that his main concern is not really about himself, but his family members and grandchildren. My field research indicates that individuals take genetic tests to know whether their disease is genetic or whether they are a carrier of a certain disease, primarily because the concern is reproduction or quality of offspring. Although reasons for individuals to take genetic testing vary, it turned out that the greatest motivation to take a genetic test is marriage and moreover reproduction. But what then? I think this is still not probably quite new to us, so I want to go further. What then is marriage in the culture, and based on that, what impact does it have if a person has a genetically inherited diseases? Because the time is pressing, I address here the cultural settings already. The idea is that, one, marriage is not an event between two individuals, but it is a union of two family members, or two family lines. The second point is marriage is to a person with a genetic disorder was experienced as a scandal for the family of the spouse. The third is a tendency that flows in the family line becomes an instrument to morally judge the goodness and badness of the family members who are alive, and also the deeds of dead ancestors, like imagination of how ancestors were before. This imagination is attached here. I continue with introducing one narrative. Mrs. H, with a genetic bone disorder, says, "I had a fiancé, but his family opposed our marriage, calling me a devil, curse, and punishment to contaminate the bloodline of their family." Another person says, who had spinocerebellar degeneration, which is a sickness in the brain, said, "My father opposed me to marry my wife, saying, 'You will contaminate the honor of our family and you will bring shame onto our parents.'" Then, how then does a marriage to a person with genetic disorder matter? Or what does it mean that when they say that a marriage to a person with a genetic disorder contaminate a family line? To answer this, I want to talk about ancestor worship, which is quite traditional practice, but I saw it both implicitly and explicitly in their dealing with genetic information. During my field interview, in case a disabled child is unexpectedly born in a family, I often heard statements such as, what kind of inem brought this sick child to us? So the term inem is a Buddhist term meaning direct and indirect causes based on the principle of cause and effect. There is an idea that a person who lived long and whose life ended naturally becomes a god or a ghost-like figure, which is like Hotoke or Soshin, or of his or her family line. The ghost, so the dead ancestor, protects the family line, but sometimes metes out a kind of punishment if the offspring does not properly pay attention to the ancestor by visiting the grave or does not behave socially correct. Not only that family members who are alive morally judge themselves at the moment of marriage to a person with a genetic disorder or at the birth of a child with disorder, but moral deeds of ancestors are also judged and imagined together. My research on prenatal screening also showed that some half of the interviewees attributed the birth of a child with a disability, among many other reasons, to moral deeds of themselves and their family members, in explaining whether to undergo prenatal screening or not. Like, well, I have been living in a very correct way, in an ethical way, so I should not have a child with health problems. This kind of statement was heard often amongst many explanations. Also, during pregnancy, majority or some 65% of interviewees visited their ancestors' graves, either to report about the pregnancy and or to ask ancestors for protection about the health condition of prospective children. According to a genetic counselor at Kyoto University, based on his daily counseling practices, he says that there is an idea among clients that as long as they obey the customs of one's family household, healthy and superior offspring will result and the family line is protected. This means that the birth of a child with a disorder is interpreted to be a sign of failure to obey the customs of one's family household. Another interesting empirical finding was that at the moment of marriage to a person with genetic disorder, or at the moment of the birth of a sick child, 30% of parents started to take up religious practices in order to clean up bad causes they or their ancestors may have made, which is also imagined, may have made, and to further ask for the protection. Well, I think that you may be wondering if such a superstition is really strong in Japanese society, which has a sort of reputation of high technology and science is relatively advanced. I would argue in this way. Well, when it comes to genetics, the line between science and non-scientists is very thin. There are some major explanations for this. One is a eugenic history in Japan, under which a number of disabled people were legally sterilized between 1948 and 1969, and probably even now, disabled people might be sterilized even underground, and the term genetics has become a sensitive word in Japanese society. So accordingly, genetics has become a term that might directly imply just genetic disorders or something that promotes discrimination. And two, accordingly, only minimum knowledge about genetics is taught at schools, such as the law of Mendel around beings, as we all know, and about this, scholars criticize that education on genetics is too poor in Japan, which augment misunderstandings about genetics. There was also a very interesting research by 2 genetic counselors in Tokyo on the level of knowledge in genetics amongst the freshman bachelor medical students at medical university. It showed surprisingly that more than 30% of students did not know how regressive genetic disorders are inherited to the offspring, nor is X-linked genetic disorders. This means, and of course they learn more about genetics because they are students, medical students, but they are still freshmen, just finished high school. So I saw among medical, so this means that genetics is neither properly taught before high school nor in society. I saw among medical doctors and the genetic counselors that they are careful in treating genetic information because one single information of one individual about the genetics can influence the whole 2 families accompanied by a sense of guilt and shame, ideas of contamination or punishment and the dishonor. Now, I would like to talk how genetic information is protected, and it's protected at medical institutions. So yes, in the hospitals, and its effect I observed during my field research. In medical institutions in Japan, usually genetic information is kept confidential, and doctors from other clinical departments only have conditional access to this. The genetic department provides a locker for storing handwritten medical records, while all other non-genetic medical records are computerized. This system of storing information aims to prevent any leakage of genetic and inheritance information to unauthorized medical professionals and outside society. At the first glance, this treatment of genetic and inheritance information as fundamentally different from other physical medical information, so fundamentally different compared to other health-related information, might appear to be justified and understandable given the stigma around hereditary genetic diseases. But what I witnessed is that a closer look at these policies reveals that the exceptional treatment of the information is based on a culture of shame and stigma around hereditary diseases. As a result, the name of genetic department within the hospital is thought to contain special secret sickness and uncommon physical and mental conditions. Accordingly, the general population tends to believe that they have nothing to do with genetic department or genetic information. And then I came across very interesting narratives, such as, like, oh, I thought genetic departments have equals to something very severe, such as heart organ transplantation, or like, my pregnancy has nothing to do with genetics, but pregnancy is about reproduction, and it's so much about genetics, but they may say, like, oh, my pregnancy has nothing to do with genetics. Well, in this situation, a number of scholars attempt to raise knowledge in genetics in Japan by setting forums, open forums, and so on. And, yeah. So, yeah, this is my presentation. Thank you very much.